programs of excellence. This program has reached and changed the lives of millions who are now literate. It has created working opportunities. It received recognition awards at national and international level. The subcommittee has resolved that the country should continue using the program as it has had a dramatic impact on illiteracy, and there are still many more people in our country who require such a program. The sector is currently finalizing a national policy for Grade R, which intends to make Grade R compulsory through the adoption of the Basic Education Laws Amendment Bill. The International Association for the Evaluation of Educational Achievement, which runs the test Trends in International Mathematics and Science Study, or popularly known as TIMSS, has shown in the most recent results that South Africa achieved the largest improvement in learning outcomes between 2002 and 2015 in mathematics and science from a very low base. Our improvement was marked as the best improvement amongst all countries that were assessed in the 2015 TIMSS round. But despite the TIMSS improvement, we still have concerns about low numbers of success in mathematics and science subjects, and we intend to do more in order to improve in this area. The sector is concerned with and is actively implementing programs that deal with challenges of poor learning outcomes, high dropout and repetition rates, particularly in grades 9 to 12, and social challenges such as teenage pregnancy, bullying in schools, drugs and substance abuse, violence in our schools, corporal punishment, and health-related challenges such as tuberculosis and HIV and AIDS. Procurement challenges related to learning and teaching support materials, the provision of infrastructure, and particularly provision of school infrastructure. The matter of the mergers and closures of small, unviable schools and provision for children living in communities where these are located, as well as the eradication and phasing out of multi-grade schools. These are all challenges which we must still give attention to. The sector is also focused on resolving challenges of strategic, administrative, as well as professional and governance leadership and management in the different layers of the sector. Management and administrative lapses need to be addressed, and continuation of programs that strengthen literacy and numeracy among school children need to be heightened, particularly beginning at the foundation phase of schooling. The sector is working on strengthening its unit that focuses on the evaluation and development of teaching and learning. In higher education, the Higher Education and Training sector has introduced a newly structured National Student Financial Aid Scheme, which seeks to enable fee-free education. We have provided this as a pilot from 2014 onwards, as directed by National Conference in 2012, and we have consolidated the infrastructure requirements with estimated costs to expand the post-school education and training system already worked out, and linking this to and coordinating it from the Presidential Infrastructure Coordinating Council. So we have developed a very clear, well-crafted infrastructure development plan under the PICC and are implementing as part of PICC programs. The policy on free higher education to all poor undergraduate level students has not been formally adopted as full policy as yet, and is still a subject for discussion and conclusion within the African National Congress, and we've not as yet fully finalized the policy on community service for all graduates, which we had set for implementation from December 2017. Within the health sector, the sector has reactivated programs to ensure that the district health system is functional in all provinces as a practical way of strengthening primary health care. We have gazetted the white paper on the National Health Insurance, or the Health Department has done, for public comment. We did this in December 2016. NHI pilot sites have been activated, was it 2015? Have been activated to prepare the health system for implementation of NHI. And work on the establishment of the NHI fund has been progressing steadily. And the white paper on NHI is currently being finalized and will be presented to the Cabinet in due course. The sector has performed extremely well in its programs directed against HIV and AIDS, resulting in fewer deaths and increased life expectancy for all our people. It has reduced overall mortality rates in the country. We have seen a dramatic reduction in maternal mortality, a considerable drop in mother-to-child transmission, a reduction in child and infant mortality, and a decrease in tuberculosis mortality due to successful antiretroviral or ARV treatment. The sector has instituted game-changing interventions such as gene expert testing and has evidence of TB disease burden declining. We are, however, concerned about TB remaining the primary underlying cause of death in South Africa. On policy programs and recommendations for debate and further development, we are focusing primarily on injecting more energy into implementation in the African National Congress and in government, where government serves as the ANC support for implementing African National Congress programs. The ANC Subcommittee on Education, Health, Science, Technology and Innovation recommends that we need to reconsider the ANC policy cycle, which we believe should be increased from 5-year periodic changes to at least 10 years, because we find there is too much policy change which doesn't allow embedding of programs that lead to success. The science, technology, and innovation sector recommends that the ANC ensures that government and business are more adequately incentivized, encouraged, or indeed compelled to use and increase their uptake of locally produced technologies. That we should ensure that government provides increased support for postgraduate funding for poor students to increase South Africa's research capacity. That we should review postgraduate funding to improve race and gender retention of researchers and adopt policies that promote the recognition of the prevalence of science, technology, and innovation in the daily lives of all people. That is, more attention to the fourth industrial revolution and the changes emanating from that technology leap, and that these would serve to encourage learners in schools, students at colleges and universities, and workers in every sector to invent new technologies and products by analyzing and learning from those that are transferred and imported from other places. The basic education sector recommends that the ANC should develop policies and take active steps to prevent vandalism at schools and to protect all education public property. For example, health clinics, community halls, colleges, university, and school infrastructure should be guarded jealously by every community in our nation. We should develop policy on schools to provide for a focus on talent development. For example, the development or establishment of public schools for talented or particularly gifted learners. And we should ensure that increased numbers of young people are supported to enter technical and vocational education. In fact, we should have a technical and vocational education revolution in our country. We should have a special focus on mobility from school to college and university to ensure greater success and skills development. In higher education and training, the ANC believes that it is important for government to ensure that the location of institutions allows for seamless articulation and mobility and coherent implementation of government's human resource development strategy, where specific attention should be given to professional colleges in fields of study such as nursing and agriculture. At the moment, there are colleges residing under education and training. And then you have colleges that are professional specific under health or agriculture. We need to bring all of these under one house in order to ensure seamless articulation and mobility. And of course, the college articulation and mobility should also address access to university beyond college study. The higher education and training sector recommends that the ANC develops policies to clarify the nature and role of the entire college sector, which comprises community education and training colleges, technical and vocational education and training, and other colleges that I've mentioned of specialized focus on professions such as agriculture, nursing, emergency care colleges, policing, and teaching. We should provide clarity on programs offered by all colleges, particularly the TVET, community education, teacher training, and those I have referred to earlier. We should promote increased quality of learning and teaching in the college sector. The sector further recommends that the ANC ensures that the sector accelerates and completes the opening of professional colleges to increase training in agriculture, nursing, and teaching, ensures that the sector finalizes and puts into operation the model for free higher education for poor students and increased support for families that cannot afford higher education costs, and complete this by 2020 at the latest, as part of the process of ensuring free higher education for all students from poor families. We should ensure that the sector develops incentives and funding to increase the number of young people entering scarce skills programs, ensure that the sector finalizes the framework for regulating higher education fees, and redesigns the funding formula for the college and university sector, as well as ensuring that the sector implements the Central Application Service by March 2018 and implements across the post-school education and training system by 2020, and puts in place policies to facilitate an increase in the retirement age of academic staff. Your brain doesn't atrophy when you reach 60. You can actually continue offering academic teaching at a much later age. In the health sector recommends that the African National Congress ensures that the health sector continuously strengthens measures to improve the quality of care delivered by health practitioners in the public and private sector, that it drafts and promotes policies to curb medical malpractice, that it to curb the high costs of medical insurance and litigation against medical malpractice, that it adopts a policy for the country to eliminate on or before 2027 all vaccine-preventable diseases which have existing vaccines with proven efficacy, and ensure the revitalization of military health infrastructure, including acquisition of modern health technology and adding in developing these to economic growth through jobs created through developing modern medical technologies. So in conclusion, the Subcommittee on Education and Health is satisfied that this policy discussion paper is a fair and objective review of the implementation of policies adopted at the 53rd National Policy Conference, a good assessment of policies and programs. It is also content that it has evaluated the adequacy of all ANC policies in each sector, that it has proposed areas for policy review and tabled proposed new policies in each sector in the context of seeking radical socio-economic transformation and inclusive economic growth. The ANC is satisfied that all sectors have made good progress in implementing resolutions of the 53rd African National Congress National Conference. The African National Congress is on track to achieve most of its goals of implementing its plans by December 2017. Every sector has tabled recommendations which we believe will close policy gaps and those that will contribute to the realization of the aspiration of radical economic transformation. The ANC is confident that this discussion paper will facilitate engagements with the masses of our people, our members, and supporters of the African National Congress and broad stakeholder groups, thus contributing to the Festival of Ideas that the African National Congress announced when it launched these discussion papers earlier this year. We are once more calling upon all our members, our supporters, and all the people of South Africa to take interest in the African National Congress's focus on education, health, science, technology, and innovation, as we believe these are core and central to social transformation in our country and broadly on the African continent. We, in the African National Congress, have noted with appreciation that South Africans from all walks of life are engaging enthusiastically with policy issues raised by the African National Congress in its policy papers. You and the masses of our people are therefore called upon to further engage in discussions of issues raised in this policy discussion paper. We are confident that this paper will be further enriched by your contributions and thoughts. It is critical that you submit your contributions and valuable inputs to the African National Congress via email, Facebook, Twitter, WhatsApp, and the ANC website addresses that are listed and will be made available on this program. Further contact details for submissions are attention, education, health, science, technology, and innovation at email communications anc.org.za. This statement is issued by the ANC Subcommittee on Education, Health, Science and Technology on behalf of the African National Congress. I thank you for your interest and look forward to your comments and submissions. Thank you.
Thank you very much to Comrade Naledi for that very comprehensive outline of the discussion document on education and health. As is normal, we will take your questions on the discussion document, and thank you once again for containing your issues to the issues that are in the document and raised in the statement delivered. I'll take 2 rounds of questions. Let me start with the first one. Number 1 will be here. Number 2, number 3. I'd love to go to number 5. Do we have any other hands? No other hands? In that order, please. Please introduce yourself before you ask your question. Thank you very much. Number 2, Giovanni over there.
I just wanted to find out, in the part of the subcommittee, the concern about only 44% of the NASFAS applications being successful, and has Minister Zimandi been engaged with?
Thank you. Number 3.
Good morning, Alvin here from SABC TV News. On the policy review being extended from the current 5 years to 10 years, does this then mean that the ANC's policy conferences should be scrapped, and as they stand at the moment, it should be reversed or taken to being, it happens every 10 years instead of the current 5 years as it stands at the moment? On fees must fall, must South Africa and students who are currently studying forget about free education across the board? Because the debate currently is around fees, that there must be free education across the board, not free education for the poor. And, joined to that question is the argument around why do you have a commission on the feasibility of free education when the governing party has already decided that there will not be free education across the board. And the final question is on the basic education department decided to introduce history as a compulsory subject up until grade 12, if I'm not mistaken. That is still not happening. It was a decision that was taken. Why is it not happening? Has there been rethinking around that? Thank you.
Thank you very much, Aldrin. Comrade Chair, if you could also direct if there any of the other panel members that you'd like to answer the questions. Thank you.
I'll ask Comrade Naledi to assist us with the implementation of NHI and what our plan is with respect to that. With respect to the private sector.
Sorry,
well,
we need you up
oh,
here.
Sorry. Okay. All right. The first question was about pushback by the private sector in response to the NHI. The National Health Insurance is a proposal of the African National Congress government, and it actually is proposing a policy intervention which countries all over the world are now considering. So we are resolute that we must create a national health insurance system in our country, and that we should have improved access to quality health care through ensuring that as a nation we contribute to providing this quality health care. So the private sector has the option in terms of the policy proposals of becoming a part of the national health insurance, which happens in other domains, that they offer particular services, because it's a package of services that would be available. And in many systems all over the world, the national health system in the UK, the private sector offers partial services or portions of the package. We anticipate that that would happen in South Africa, because to be completely out of it, then the private sector would become so unaffordable that they'd be reduced to a very small component of health providers in society. But this is subject for debate. They had the opportunity to make a contribution to the gazetted white paper, and we would now look at the conclusion as it will be presented to us very soon by the health sector. On the second question of how are we preparing to ensure implementation, Minister Motsoaledi, if you could come up and speak to it, and then on the history question, Deputy Minister, you assist us.
Yes, if I heard the question very well, Chairperson, the question on preparation was specifically about nursing colleges. How we're preparing them for to deliver nurses for future NHI. Yes, at the present moment, we have got 90 nursing colleges across the country. One of the resolutions that has been adopted by the ANC conference is that nursing is a bedside experience. And so training must take place in the nursing college, which is situated inside the hospital premises, so that the nurses must train by the bedside. At the present moment, that's not what's happening. You are aware that there's been a new curriculum of nurses from 1987, which has put some of the nurses training, basic nursing training at university level, but some of them in colleges, which have got no contact with hospitals, just colleges, standalone colleges like colleges of education. We're moving away from that. I've already met all the vice chancellors of our universities to discuss with them what that has brought to nursing care, and they all agreed, and our agreement with them is that they mustn't train basic nursing. They must allow us to train basic nursing by the bedside in the hospital. Only after the nurse has got the basic qualification can they move to university, just like it happens in the past. Nurses never used to wake up from matric and do a BCare. They go for basic nursing, bedside training. Once they've got the basics, then they move to university. We are now moving along such lines. And to that effect, out of the 90 nursing colleges, we have already renovated 10, including the biggest in the country, the Chris Hani Baragwanath nursing colleges. And yesterday when we met journalists to brief them about NHI, because we had a retreat with them, and I did show pictures of the nursing colleges that have already been completed, that, you know, in terms of this, going back to the old curriculum of nursing. We have even piloted, by the way, we've piloted that in 3 colleges, in 3 provinces. And the results of the pilot have been submitted to the Nursing Council for them to adopt. Once they adopt as a Nursing Council, then we roll over to all the other colleges, not only the 3 where we have piloted. Thanks.
So very quickly then, if I could, on the National Student Financial Aid Scheme, we have recently agreed that we would want Comrade Bladen Zimande to do an assessment of the numbers that have actually been confirmed as recipients of the NSFAS funding and those that have not been provided with funding, so that we understand exactly what the situation is. We haven't received that summary overview as yet, but it's something that we've agreed should be provided to our subcommittee. In addition, we've agreed that the subcommittee should pay more attention to NSFAS, the institution, in order to really come to grips with some of the problems that students have drawn our attention to, and to understand whether the current model of NSFAS, the institution, is sufficient to the demand that we're confronted with. So this is work that the committee is currently looking at, and once we have that assessment of uptake, we will be able to provide you with greater detail. On the policy review, we are not proposing that we shouldn't have a policy deliberation every 5 years before a national conference, but our concern is you cannot be proposing new policy every 5 years because you have a change of government, it takes time to settle down. Just as you've begun to embed a set of implementation practices, a new conference comes into being, and you're almost asking people to guess at policy. Whereas if you utilized a 5-year initial period for assessment and evaluation, and then a subsequent 5 years for rethinking policy and practice, you might achieve much more. So that's the kind of sequencing, that it wouldn't stop, but one would be for evaluation and assessment, and the other would then be for looking at new policy to allow a government to be able to execute what it needs to do. This is a proposal we are making as a committee. It is not something that the National Conference has adopted or deliberated upon as yet. On the fees must fall, no, students mustn't give up. This is something that we need to work toward, but we've said as a first prize for now, students who come from poor families that are unable to meet the means must be supported. And we are looking forward to receiving the report on feasibility. But as you know, we have taken steps to introduce a new model, which the NSFAS chairperson, Sizwe Ngasana, was leading a team in. So we are really reconsidering how can we best support young, academically able students from poor backgrounds and ensure that they do not suffer because of not having financial resources. On history, my favorite subject, Minister, Deputy Minister.
Thank you. Thank you very much for a very important question. There has been absolutely no change with regard to the intention to make history a compulsory subject. As we speak right now, from grades 1 to grade 9, history is being taught as a fundamental. In other words, it is in the curriculum. Every single learner has to do history. The issue is, what do we do in grades 10, 11, and 12, where history is chosen as a subject? So there are many learners that choose history as a subject, but there are those who do not choose it as a subject. What the Department of Basic Education had done is, firstly, it held a roundtable conference, invited all stakeholders to elicit their views regarding that particular phase, to say, should it be an additional subject for all learners, or should it be part of life orientation and life skills, so that we include in that our history as well as civic responsibilities. So there are constitutional elements that come into play. The minister thereafter set up a dedicated task team to look at this matter, comprising recognized academics and practitioners in relation to what would be the best way forward. In doing so, we've looked very closely at practices elsewhere. We've looked at the United States, we've looked at Southern America, Brazil, we've looked at China, India, and African countries, to say what is the practice with regard to the implementation of a curriculum in schools across the country. So we have to look at what the practice is in Africa. We have to look at other countries as well. And it's quite mixed. Some offer it as an additional subject. Many offer it as part of your life orientation, which is a fundamental. So we are on the cusp of implementation. But before we do so, and once we've received the preliminary report, once we've received the final report, you know, we engage and we ask certain questions, and we will then certainly engage with all the stakeholders to elicit their opinion with regard thereto. But what we can assure you is that history would be a fundamental where every single learner, from the beginning to the end of the schooling life, would be able to do that. We do so on the basis that it informs our identity as South Africans, and as global citizens. It also shapes the kind of people or citizens that we want to produce and contributes very positively to social cohesion. We might add that a lot of work has already been done in the past. Already during Minister Naledi Pandor's previous life, she and Minister Asmal had set about working towards the curriculum content itself, to improve it, to ensure that it is authentic, that it's not a distortion of the realities. And we have a wonderful set of books that deals with the history of Africa. In addition thereto, there has been research, the UNISA has developed books on South African history, which they've made available to us, and are busy with a practical guide. So it's a question of teaching and learning, it's a question of curriculum content, and it's a question principally of what is the most convenient and practicable way in which we can make history a compulsory subject. So there is no change. We can also share with you that towards this reality here, we've introduced the introduction of Indigenous African languages in schools where an Indigenous African language is not taught. In other words, schools that teach exclusively English and Afrikaans are now obliged to teach an Indigenous African language, and that would be done incrementally. In fact, more than 800 schools are already participating in the program, and the intention is by next year we should make it universal. So these are all building blocks to the creation of the society that we envisage. Thank you very much.
Thank you very much to the panel. Can I see if there are any hands for either follow-up or new questions that you would like to pose to the panel in front? Number one. Number two. Some new people, please. Going once. Twice. No, yeah, I agree with Comrade Naledi. It's very clear. No ambiguities. If you could please go, Puti. SABC?
Again from SABC News. On the proposal that SARS there must be a process that would lead to the implementation of recovering the loan portion of funding providing to the working class and the middle strata. What model does this take? Does this mean that every student who has been a beneficiary of NSFAS would then have to pay back the loan via tax that SARS would be deducting? And does the proposal also mean, is it also retrospective, like students who would have received funding or been beneficiaries pre the implementation by 2023, does it mean that they also need to pay back the portion of their loan? On the question around the NDP, if the National Development Plan proposes and says that by 2016 all schools must meet the minimum standards in terms of infrastructure and so forth, and we have a case in the Eastern Cape, for instance, where there are still mud schools, should there not be repercussions? Should someone not be held liable for failing to implement the proposal that is in the NDP? And a question that was raised last week on the Social Transformation Subcommittee was a question around sanitary towels for the culture. And KZN, for instance, has introduced this where sanitary towels are free at all schools. Shouldn't this be national, across the country, where every school provides sanitary towels?
Thank you very much.
Yes, this is a very complex question, by the way. It's not easy and straightforward. Part of the reason being that all throughout, the World Health Organization used to determine the number of health workers, not only nurses, but the appropriate number of health workers against the population. For instance, they will say, we've got 10 doctors per 10,000 population, or 2 nurses per 10,000 population. Now, they've eventually concluded that that doesn't help countries. It's completely meaningless. For instance, if you say South Africa has got 20 doctors per 100,000 population, and it's enough, but although half of those nurses are of those doctors are in Johannesburg, and there is nothing in the far rural areas, that number doesn't tell you anything. So the World Health Organization abandoned that and came up with a new mathematical formula, a complex mathematical formula called WISN. It's an acronym, WISN, WISN. It means Work Indicator for Staffing Norms, where you consider a whole lot of things. You consider the burden of disease, the rural nature. So when you calculate WISN, you don't do it per country or per district or what. You do it per institution. You say in this institution here, in this clinic, you need so many nursing sisters, you need so many clerks. It goes right up to the whole staffing, not only nurses. And it puts it there and say, these are your staffing for this particular institution. Then from there, if you have worked that all the institutions in the district, you can know for the districts. But the reason that we don't know yet, we have just completed WISN calculation for all primary healthcare facilities, meaning clinics only. We have not done it for hospitals yet. We have finished clinics and we have moved into central hospitals, and that's extremely complex because you can imagine having to calculate the staffing norms for Chris Hani Baragwanath Hospital vis-a-vis the lecturers who are adverts, who are part of that staff. So it's complex, but they are fitting it in now, they are working on it. And once that is completed, we'll know the staffing norms. So if you even agreed with Treasury, that's once we finish, we'll submit it to Treasury and say these are staffing norms for each and every health institution and health facility in the country. But for now, it's work in progress.
Well, thank you for the question. The programs that I can draw your attention to, firstly, is the ACD program, which is an accelerated school infrastructure development initiative undertaken by the presidency. And as a result of that initiative, we had committed ourselves as government to replace mud and unsafe schools. The realities as we confront this challenge here is that we've successfully eliminated mud schools in 8 of the 9 provinces, and the provinces where the problem persists, and because of the large scale, the huge area that we have to cover is the Eastern Cape. But the Eastern Cape alone has been the beneficiary of more than 120 state-of-the-art schools provided to them. Now, what do we do with these schools? We ensure that they exceed the minimum standards. You can go to any one of the ACD schools and you would find that they have, it's a primary school, it would have dedicated areas for grade art learners, it would have a kitchen, it would have ICT, it would have a library, resource center, and it would have sporting amenities. Now, these schools are necessary because we have to create an environment that's conducive to learning and teaching, and therefore we've ensured that the minimum standards apply. Now, the second, and as we speak right now, 179 schools have been delivered. On Wednesday next week, the ministry, either the minister or the deputy minister, will be delivering a state-of-the-art school in Dunoon in the Western Cape. The Western Cape has been the recipient of more than 23 schools. We've targeted 26 in the area. These replace your planky schools, as they are schools that are made unsafe schools, wooden schools that are unsafe for an environment. So the ACD program has contributed 179 schools, almost an average school per week. In addition thereto, you have what we call the Education Infrastructure Grant, where provinces have to provide schools. And we can share with you that provinces have provided more than 820 schools across the country replacement schools, and these schools, all of them, have to comply with the minimum standards. The challenge is, and indeed basically is, how do you deal with the massive structural deficiencies? We've got to be practical and realistic, and this occurs progressively. What government has done, it's dedicated 10% of the resources allocated for the budget to say utilize this for maintenance. Because in many occasions, because maintenance is not provided for in the budgetary allocation, there's a rapid deterioration of the infrastructure, and this contributes to diminishing standards. We certainly ask provinces to monitor. They provide us with a report, and they've, amongst other things, raised certain issues. So, for example, Gauteng province receives more than 30,000 learners each year who have not even applied for registration. So you have this phenomenon of migration from other provinces to Gauteng. Now, they have to basically deal with schools. And how do you accommodate those learners? You can't keep them out of schools, and you've got to basically have temporary measures on occasion to accommodate those learners. Lastly, in relation to the phenomenon that you've raised with regard to mud schools, whilst we are replacing mud schools in the Eastern Cape, we've also discovered that schools, some of the schools, certainly do not conform to the standards in the norms of practicability and rationality. You have a school with 30 learners, which is a mud school. And you have a school just less than a kilometer away with 120 learners. The most practical and practicable thing to do is to merge them and provide better resources. And we've undertaken that particular exercise. We've developed guidelines, and we've reduced across the country, rationalize, merge, and close schools. And this has contributed to a much more greater efficiency. As we speak right now, approximately 2,000 schools have to be merged, combined, and merged. And we thought it's better to ensure that there's better planning and management of that particular process so that each and every learner has an environment and amenities that are conducive to learning. But thank you very much for the question.
Thank you very much. I think it's important to say that having a framework of national norms and standards is very important, and it was a good step taken by South Africa. But achieving that requires a great deal of resourcing, of very, very careful planning for implementation, because the problem of inadequate infrastructure was a fairly significant one. And I think great strides have been made. So it was important to agree that we set a national norm and standard. And working to achieve it is evident in the statistics Deputy Minister has referred to, but also in the number of schools that have been opened in the past 5 years. So I think this was a very progressive step forward by the state, and we continue to provide increased infrastructure. We do monitor whether provinces are acting to improve infrastructure and whether funding devoted to infrastructure is being utilized for that purpose. It's one of the areas we from time to time had Comrade Angie Mchecha step in order to ensure that the resources for education are used for the purpose for which they are intended. And I believe progress is being made to address this huge infrastructure problem in our country. And this is why we are making, as the subcommittee, a very strong appeal to the people of South Africa to protect education facilities. Because when you burn down 20 schools, it means we have to redirect resources that were intended for 5 or 10 schools in one province to the province that now has a new gap in the provision of infrastructure. So the destruction of education, property, and facilities, and any public facility is a major drag on the advances that we would like to make. On the loan recovery model, well, there is a model already through SARS. When you graduate, if you have been a recipient of NSFAS funding and have a loan component, once you are employed and earning at a particular level, through the tax, the revenue system, we then have SARS withdrawing, and this goes back into a common pool to fund more young people who are still studying. I think you could actually do an exercise through your programs that you do very well and identify 50 young people who are previous beneficiaries. There may be some even in here who receive NSFAS funding and who've already paid back. I meet many who say what a difference the NSFAS funding made to them, and how even though they hadn't reached the earning threshold that is set for recovery, as soon as they began working, they started paying back even a minimum amount, but they were so glad to make a contribution to the nation's development. So the scheme would work as currently set out. But what has happened, there's been an implementation failure where funds were not being recovered, or there wasn't a follow-up of students. Many young people have said, I was prepared to pay back. Nobody phoned me. I received no letter. Next thing I saw, I'm blacklisted. I could have paid back. So all of those flaws need to be addressed in order to ensure that the scheme works appropriately and that more and more funding is available to support young people. But what we are aiming toward is that students who come from poor backgrounds should be provided free higher education. This is the policy intention that we have adopted. As to whether this would be retrospective, as I say, the policy is currently underway, and what has been addressed is improving the communication and tracing of students. Interestingly, through their effort and call on the higher education department to say, I want to pay back, but you've never contacted me. Please let me know. How do I pay? So it's been young graduates who've said the system is failing us. And I think this is absolutely fantastic about our young people. On this, on the sanitary towels, well, I'm not totally familiar with the KwaZulu-Natal model, but I think we've been trying through social development, basic education, and the Women's Ministry to have a conjoined program where we address this particular inadequacy that young women, particularly in poor communities, are confronted with. And I think, all congratulations to the Department of Basic Education of KwaZulu-Natal, and all departments should be looking at speeding up providing sanitary facilities and support to young women. I know there is an initiative, health is part of it, basic education, women, and social development. And we should be doing perhaps much more. The private sector has also stepped in and makes a contribution, and from time to time, the public is allowed is rather asked to make a contribution. So the nation is fully alert to what we need to do, and I think more and more to ensure that young women are able, in dignity, to remain in school and pay attention to learning.
Thank you. Thank you very much, Comrade Chair, all comrades present. We've come to the end of the briefing. We request that you do continue the conversation with us on social media. Comrade Naledi Pandor will be in a live chat on our Facebook and Twitter pages. So please do send in through your questions and let's continue a discussion. There are 3 more sessions left before the conclusion of this series, being peace and stability, legislature and governance, as well as international relations. So we look forward to seeing you next week when we speak to the discussion document on legislature and governance. Thank you very much and enjoy the rest of your Mother's Day. Thank you. No problem, Comrade Enda. We're just happy that you came. But these things are amazing. We've eradicated mud schools in 8 of the number. We need to, I don't know what we need to do now.
We're doing some very, very good work. It's a good story there. Huge challenges, but good stories. We try to raise it whenever we can.
I'm going to try and see if I can also speak to Elijah and Troy and them and see how we work out. You know, when we sit here, we're like, thank you, Comrade Enda.
I've been watching.
Thank you.